Thank you for presenting the slides for us.
Well, thank you, Stephen, for the awesome overview of HRSA. And so now you saw our organizational chart. So we're moving away from HRSA, and now we're going to, I'm going to talk about the Office of the Assistant Secretary for Health, which is housed under the Office of the Secretary of Health. And under the Office of Secretary for Health, we have the Office of Regional Health Operations, of which there are 10 regions. I represent Region 6. I am Lieutenant Monica Geiger. I am an active duty officer in the United States Public Health Service, which is the only uniformed service that is solely focused on public health. We are a cadre of 5,900 healthcare professionals, and we're led by the Surgeon General and the Assistant Secretary for Health. And I'm a nurse by trade. And so if there's any questions I can answer for you about the United States Public Health Service, please let me know. As far as the Office of the Assistant Secretary for Health, we have a main mission of providing regional coordination and support for departmental public health initiatives and accelerate implementation of public health policies. Our vision is to increase opportunities to improve the health and achievements for ourselves and our communities. We do this by identifying gaps or issues in public health, policy analysis of existing interventions and prevention strategies. And finally, supporting partners like you guys in evidence-based execution of programs. So we absolutely love to hear about what's going on in each one of our 5 states and how we can help and support you in your programs. So this is the, you can see our map of the regional offices. Again, we are Region 6. If you are interested in connecting with any of the other regional offices, I would be happy to help you do so as well. Here in Region 6, our priorities are vaccine confidence and immunizations, COVID-19 prevention, substance use disorders, opioid use disorders and harm reduction, HIV prevention and treatment, health policy analysis, healthcare access, climate change, and environmental justice, which is actually a new priority for us. The Assistant Secretary is placing a lot of emphasis this year on climate change and environmental justice, so much so that she created a new office, the Office on Climate Change. So please reach out if you have any questions about that. Region 6 additionally has maternal health as a priority. And we also have chronic disease and conditions as a priority. And when we're looking at these priorities, we look at them through 3 main lenses. We look at them from an access to care standpoint, a health equity standpoint, and a healthcare coverage standpoint. So in all the work we do, we try to think about, does the population we're serving have access to care? Are they able to access care equitably? And are they able to pay for that care? And so that's a nice segue into the next topic I'm going to be talking about, which is health equity and social determinants of health. So the social determinants of health are conditions in the environment where people are born, live, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. They're grouped into 5 categories: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community context. Examples of social determinants of health include safe housing, transportation. We know that President Biden just recently signed into law a big bill to build our infrastructure, which we hope will help with transportation issues, neighborhoods, racism, discrimination and violence, education, job opportunities, and income, access to nutritious foods and physical activity opportunities, polluted air and water, language and literacy skills. Those are all examples of social determinants of health. We are all different, and equity means that everyone has tools and the supports that they need to make the healthy choice. And not one tool works for everybody. So we need to make tools for the individual to be able to support them. Racial inequality is a powerful social determinant of health. Racial inequality, like socioeconomic deprivation, shapes exposures, vulnerability, and consequences. At a given income level or educational level, African Americans and Latinos on average have less wealth, poorer neighborhoods, poorer childhoods. Race often captures unmeasured social economic factors. It's really a serious health problem. A growing body of research shows that centuries of racism in this country has had a profound and negative impact on communities of color. The impact is pervasive and deeply embedded in our society, affecting where one lives, learns, works, worships, and plays. And this creates horrible inequities. So I really like this image. This is the image of Homeowners Loan Corporation, their map of how they would rate the different neighborhoods in terms of risk to the lender. So as you can see, this is a map of Dallas, Texas. And as you can see, there are certain areas that are considered the best, certain areas that are considered still desirable in blue, definitely declining in yellow, and D in red is hazardous. History, culture, institutions, policies, and codified practices perpetuated inequality by promoting an ideology of inferiority. So as you can imagine, our communities of colors were mostly located in that red area. And this is called redlining. Now, this is a map of Albuquerque, New Mexico. These red areas represent racial covenants. And what that was is, for example, housing, an HOA property record might say that certain groups of people in New Mexico, this often affected Hispanics, could not own or occupy certain land. So when an owner would sign a contract, they would have to say that no person of color would ever own or occupy this land. These covenants can be found on books in every state in the United States. They are now outlawed through a Supreme Court ruling, but it's an ugly reminder of our past that we don't want to replicate. And the effects of these covenants on minority health still linger to this day. And it is our job to address these inequalities. So now I'd like to talk about some of the resources that we have available to you. First, I want to point out vaccines.gov. Vaccines.gov is a great resource for you to find a COVID vaccine available in your neighborhood. And if the vaccine isn't available in your neighborhood, please contact us because we would like to know that, and we would like to make more vaccines available where they're needed. So please, I got my COVID vaccine and I got my booster shot, and I got my my influenza vaccine as well, my flu shot. The flu shot can be given safely with the COVID-19 vaccine, so we encourage you to get both. Confronting misinformation, what can we do about it? So the Surgeon General put out an advisory on building a healthy information environment. In recent years, the rapidly changing information environment has made it easier for misinformation to spread at an unprecedented speed and scale. And that's a quote from Dr. Vivek Murthy, who is the Surgeon General of the United States. The Surgeon General also put out an amazing misinformation community toolkit that I'll share the link for here in a moment. This toolkit can be used by you and your community to address some of the misinformation that you're seeing. Culturally competent providers and providers who share the same race, ethnicity, and/or language as the patient have been shown to be more effective. So we want the opportunity for you to experience culturally competent healthcare. And Think Cultural Health is a program that promotes this. On September 30th, OMH, which is the Office of Minority Health, announced the awardees for the center. I'm pleased to share with you today that the awardees are the Oklahoma State University Center for Health Sciences and the University of Hawaii. The project period for the grant began on September 30th, and we look forward to updating tribal leaders informed of their progress in the coming months and continuing to receive your feedback to inform the work. We are working hard to recruit tribal leaders and their appointees to the Tribal Advisory Committee. Please let us know if you are interested or if you know somebody who might be interested. The deadline is January 7th. And I love this resource here. This is the Minority Health Social Vulnerability Index. Systemic socioeconomic inequities like poverty, poor housing conditions, and lack of access to quality healthcare lead to worse health outcomes among racial and ethnic minority populations in the United States. Such factors are increased risk for the ability of racial and ethnic minority populations to anticipate, confront, repair, and recover from the effects of a disaster or public health emergency. These factors combine to form the concept known as social vulnerability, and you can use this tool to see how your community is doing and how your state is doing. The Medicare open enrollment period with Medicare ends December 7th. Every year you have the opportunity to review and compare your medical plan choices and pick the coverage that's best for you. You can choose to join or switch a Medicare prescription drug plan. So take advantage of open enrollment, which again ends December 7th. So that gives you a full 7 weeks to compare and make decisions. And this is more about our health insurance open enrollment. And then I wanted to share with you these currently open or forecasted grant opportunities through the Office of the Assistant Secretary for Health, which is available on grants.gov. This is not an exhaustive list. I would encourage you to go to grants.gov and search your topic of interest to see what grants might be available for you. And also, I want to encourage you to attend our webinar series, Increasing Health Equity in Breastfeeding. This first one here just happened, but we would love to invite you to our next webinar, which will be December 1st, and is entitled Policy to Protect Our Moms, Supporting Breastfeeding and Ongoing Accountability. And please reach out with any questions and to register for that. And here's our contact information. Ella Pierce, who could not be with us here, unfortunately. She's the Regional Minority Health Analyst. And Monica Geiger, I'm the Regional Women's Health Analyst. Please feel free to reach out to any of us with any questions or concerns. We'd love to hear from you. And finally, we have discussion questions, and we're hoping that you'll participate with us. We set up this cloud map. So please, I'm going to put this link in the chat. And I hope that you'll participate. And while I'm waiting for people to participate, I have a couple of really bad jokes that I want to tell. And this is to encourage you all to participate even faster, because the quicker you participate, the faster I stop telling my jokes. So here we go. Here is you'll see your answers come up here as we go through and people add things. Again, the link is in the chat. So, Stephen, do you know why you never lie to an X-ray technician?
Why?
Because they can see right through you.
Only one answer. We need more.
Do you know why consuming ants is good for your health? It is because they have antibodies.
I might need to mute myself real fast.
Yeah, you're killing me over here.
These are good though. I appreciate a good joke.
I tell you. And look, and I was learning so much for a while. It was going so well.
No, but we have a bunch of really good things popping in right here in this word cloud. And I'm so glad this can be interactive like this, because I mean, yes, post-COVID economic recovery, like we all know social determinants of health economics impacts that health, right?
Mm-hmm.
We also can think of historical factors like what colonialization did, colonization did to the health of those who were here before European settlers. And as well as things like poverty, and I see diabetes is on there, and a lot of these things are social determinants of health, it's looking like. Low health literacy, I know OASH, that's a huge priority for OASH, right, Monica?
Mm-hmm.
Oh, absolutely. Health literacy is so important in every aspect of health, especially when in chronic disease, when we're trying to think of ways to prevent chronic disease. We love to do educational initiatives, and would love to hear more about some of the educational initiatives that you guys are interested in having.
Absolutely. And I know Surgeon General misinformation is the big report that came out, and how that's such a cause. I see it in the chat as well as on the word cloud. So do you think
misinformation is a huge issue, and the Surgeon General is such a huge issue that the Surgeon General took it upon himself to address it. So definitely important that we're putting out the correct information there, and that we're messaging in the correct way.
Absolutely. Well, do you think you need another joke, or have we got most of the participants with their responses?
I do have one more joke, if you'll tolerate me. So why did the skeptic suffer from high blood pressure? Because he was taking everything with a grain of salt.
Oh no! Oh
goodness.
I
no!
think that affected my blood pressure.
Right.
Well, I hope someone was recording that.
I love it.
Stephen, there's a question for you here. What is a block grant?
A block grant, right? So the Maternal and Child Health Bureau has block grants that go to states and jurisdictions. It's just a chunk of funding that then is used for different priorities. So each state has its own way that it spends its money.
Okay.
On different types of programs. So that's what it means by block grants. Because MCHB, which is the Maternal and Child Health Bureau, also has other grant opportunities, but they're usually program specific. Things with children with special health needs, funding for programs like that. So it's just, in terms of MCHB funding, block grants are one of the biggest ones. And I mean, by virtue of the name too, it's just a block of funding that the state gets to do MCHB work or MCH work with.
And when you were speaking about the webinar series, Advancing Health Equity amongst the Hispanic population,
Yes,
did you say it's in Spanish, but it's been translated to English? Is that how I understood that?
Yep, that's correct. So it is the first time, to my knowledge, that HRSA has done, at least our Office of Intergovernmental Affairs has done a webinar series where it is actually presented in Spanish. And it is then simultaneously translated to English for those of us, like I don't speak Spanish, but I would still be able to watch it while it was going on and hear what the translation is. Yes.
Great. And then Lieutenant Geiger, we put on quarterly meetings, and they're really educational meetings that happen once a quarter. And we are really addressing health equity within CDPC. Is this something you could present again? Instead of providing a recording of it on our website, is this something you could come back and do for us again?
I would be more than happy to.
Great.
And I noticed that someone put in historical trauma and colonization in our word cloud here, and I'm so glad to see that. I'm Puerto Rican, and this definitely affects me personally. Before the contraceptives pills became widely used, they were actually tested on Puerto Rican women.
Wow.
A lot of times without their knowledge of side effects or other sorts of things. So and it's unethical practices like that has happened in our history that has really created a culture of mistrust, specifically in the Hispanic community, and I'm sure in other minority communities as well. And that's something that we're looking to combat.
Great.
Absolutely.
And then I think we have one more word cloud. Thank you everyone who participated in this first one. Let me see if I can go to the next.
And Stephen, I'm going to ask you a question while she's doing that.
Yes.
I noticed that you mentioned that the telehealth component has been really important in the grants or monies that have been distributed from HRSA. So that's something that are you hinting to us that we should include? Should we apply for a HRSA grant?
No, so it's not normally a requirement of all HRSA funding, but there is supplemental funding for those who are already receiving HRSA funding to enhance capacity for telehealth, or there is funding there to promote best practices through telehealth. But by no means is anywhere required 100% to have to do telehealth. But it is highly encouraged if there's the capacity for that. And mainly the purpose of me putting that there was knowing that there are a lot of rural and frontier communities in New Mexico that might be able to benefit from that, especially as access to broadband is brought online with the new infrastructure bill and whatnot. So like just thinking forward, there's funding there now that can start the kernels or the nuggets that it can grow and grow as telehealth is further expanded, as well as we get more clarification on the CMS rules on reimbursement for that post-pandemic, things like that. So that was the purpose of putting that slide there.
And then Monica, we couldn't access that web link because for whatever, we couldn't click on it. So that's probably why you're not seeing anybody participate in that particular question. When you put the link in the chat, there it goes. Thank you.
Yeah, and this was also something that we would love to hear from. Oh, sorry, Monica, I didn't mean to cut you off.
Oh, no, you're fine. Go ahead.
I was going to say, we really want to know how we can make this better. Like, I love the fact that we can do this webinar, and I'll sing the council's praises for inviting us for this and having us do this as an opportunity. And we want to know what else we can do, right? Like partnership. We would love to be able to connect and talk about what that looks like. And we definitely want to be able to prioritize in HRSA the opportunity to visit and see what it is like in New Mexico for sites, like how people are either accessing HRSA funding and or how could those who are not currently accessing funding then access funding, right? What else is there? Like, do you want to see workshops, technical assistance? I'm not trying to give you all the answers, but that's really the purpose of why both Monica and I wanted to hear this, because we've been working really closely on this, and I can't see why we wouldn't continue doing that. And how do you make it better?
Absolutely. And I noticed someone put in the chat mistrust in Black community related to vaccines. And that is such an important issue to address, because, there are many people who have refused the vaccine due to mistrust and violations in the past, like the one that I spoke about. So we would love to talk with you about the vaccine and answer your questions. If that's something of interest, please let us know. We would love to sit down and have that conversation with you.
I am just so pleased about how approachable you guys are. We just really want to thank you for that, because like a lot of times when agencies think about what it means to interact with the federal government, a lot of biases, preconceived notions come into gear. And what we forget is that all of us are really here to partner together and grow together. And I just think that you're just like really great to speak with. So are we able to like reach out more? So that's like an open invite, because there are a lot of really great agencies listening to this. And I just really want them to increase their participation with the region, because New Mexico can be more specific about how we can participate, I think, sometimes.
Absolutely, and we appreciate that. It helps to have warm and welcoming hosts. So thank you again for inviting. I just put my email in there. I know, Jay, you've got it, but that's for everyone else as well. It's always open. Feel free to reach out. And, if I don't have the answers for something, we'll figure out. And I know Monica and we work with a lot of the other federal agencies under HHS, and as well as other departments. I have I've done a lot of work with HUD, Housing and Urban Development and whatnot. So we're always here as kind of the federal experts, if you can say. I wouldn't call myself an expert necessarily, but definitely here to help navigate those sorts of things as the need arises. You've seen us, you know that we're approachable, and we're definitely here and want to help.
Absolutely. We're happy to facilitate any connection that you would like to have, whether it's with us or with any of our federal partners. Again, I'm so glad to have Stephen with us in the office, because he's an amazing point of contact and is always willing to partner on things like this. So I know that he's a resource that I can rely on, and the same, I'm always a resource that he can rely on. So we work together like that, and we can also connect you with other federal agencies as well, so that we can make this great work happen.
Thank you.
Thank you. Thank you.
I was getting ready to say, you got to share the screen a little bit. Come on. Where's our turn?
Time to pass it off.
We can't thank you enough. Really, it's been a pleasure to have you both here. You are so approachable, both of you, and you can tell you guys are hard workers. I can just feel it. You have great energy, both of you. So thank you again, and thanks to Jay for reaching out to you. This has just been amazing. I've learned so much. Thank you.
Thanks so much, Trish.
Okay.
Thank you very much.
Well, guys, before we go on a break, because we know that we've got some folks who've been really just hanging on to this presentation. Monica and Stephen, thank you so much. We were just like talking about everything that we were learning that was different. I mean, Stephen shared some of the data points. 88% of HIV folks that are on the Ryan White program are virally suppressed. That's huge. And then 70% improvement in rural activities. New Mexico, 70% increased. What does that mean for us? How are we participating? And then, of course, the HRSA funding guide. Wonderful. Thank you so much for that link. It will be utilized often. Monica brought in the Think Cultural Health, going to health equity, going to the free trainings that are on the website, free cultural health trainings, CEUs. You can get them through thinkculturalhealth.hhs.gov. And also that new thing, the Social Vulnerability Index. I'm still trying to like dig my fingers into that one, but I want to be able to use it. And like both agencies really shared a lot of great free training opportunities. And now we can say multiple languages. So it's just getting better. So, folks, really want to encourage you to think about checking out some of these websites to be more inclusive and thinking about how can we partner with our federal entities, agencies that are here to support us anyway. Of course, there is a process. We have to receive federal funds. We either have to partner with the Department of Health that has those block grants, or partner with another agency that has already gone through the steps, or figure out how your agency can become qualified and register through grants.gov, register to become a recipient of federal funds as well. So there are some processes. Contact CDPC, contact Trish, contact Laurel. They'll be happy to guide us all through that process. Right now, how about we do need a break? So let's give us about a 5-minute break, and then we can come back right before, about 2:13, 2:12, something like that. Thank you again to our federal partners. Wonderful information.
Absolutely.
Yeah, we'll be able to use it for many a year.
Much gratitude.
Much, much.
Yes.
And we will see everybody shortly, hopefully by 2:15 or so. All right, take a break, folks. Enjoy yourself.
And thank you again for this opportunity to be here.
Thank you.
You got it. You got it.
Definitely.